Sarah Smith is a 48-year-old female at your office for her annual exam. She is on blood pressure medications, but her blood pressure is not always controlled. She also has a BMI of 30, which puts her in the overweight category. Additionally, she has high cholesterol and family history of heart disease. Her father had a heart attack at age 72. She has completed the audit screening tool as part of her annual exam and received a score of 12. The most common components of brief interventions/counseling that have been shown to decrease drinking are 1. Expressed concern from the provider regarding unhealthy alcohol use. 2. Feedback linking the patient's drinking to his or her health issues. 3. Education about recommended drinking limits. 4. Offer of explicit advice to cut down drinking or abstain. 5. Follow-up 2 to 4 weeks later to assess the patient's response. 6. Referral to specialty addictions treatment if indicated. The most effective interventions are explicitly patient-centered and non-confrontational. Asking the patient's permission to discuss, eliciting their thoughts, and using reflection are several methods recommended for engaging patients in behavior change. Longer counseling sessions are not necessarily better. 5 minutes of advice has been shown to be as effective as 20 minutes. Based on what you have learned from the SBIRT modules, think about how you can have a conversation about the results of the audit screen and help her to begin to think about behavioral changes as it relates to her alcohol consumption. Raise the subject.
As part of your annual exam, you completed the audit screening tool regarding your alcohol use. Is it okay if we go over the results? According to the results of the audit screen, you received a score of 12. This means that you fall in the zone 2, or at risk for drinking.
I don't see myself at risk for a drinking problem. I only have a few drinks a night to help me relax after a long day at work. I've earned the relaxation. My job is really stressful. I really enjoy the taste of wine and bourbon.
The recommended amount of alcohol each week is 7 drinks for women and 14 drinks for men. Tell me a little bit more about your drinking. What is it that you like about drinking?
Well, I get home from work and I have a glass of wine while getting dinner ready. It helps me unwind from the day. Then I'll have 1 or 2 glasses with dinner. On weekends, I might have bourbon before dinner and split a bottle of wine with my husband over dinner. As I said, it helps me relax after a very long day at work.
How often do you have more than 5 drinks at a time?
The only time I've had more than 5 drinks would be like during special occasions such as a celebration or a wedding. Usually this happens maybe a few times a year.
Has there ever been a time when you felt bad or felt guilty about drinking?
No, I don't really feel guilty about my drinking. I almost never get a hangover, so I don't feel that bad.
Has any friend or family member ever told you that they were concerned about how much you drink?
My adult children have commented on my daily drinking, and they think there's no need to drink daily. They're also concerned about the message it sends to their children, but I think they're just blowing it out of proportion. When we get together, everyone has a drink, even them.
Provide feedback.
I see from your chart that your current blood pressure readings are not what we would like them to be. You also have high cholesterol and family history of heart disease. Unhealthy drinking can potentially compound these problems.
Well, I have been trying to lose weight and manage my blood pressure and cholesterol with diet and exercise.
Alcohol has empty calories and can contribute to high blood pressure and high cholesterol, as well as your weight. Cutting down your alcohol consumption could be an easy way to decrease your calorie intake.
I didn't know that alcohol contributes to so many health problems. I thought it was only my diet, and I'm trying to change what I eat.
Enhance motivation.
Let's talk about your drinking. You said you drank alcohol to relax. What else do you like about drinking?
I guess I drink to be social with my husband at the end of the day, or when we go out with friends. It has just become a habit.
What don't you like about drinking?
Oh, I like drinking, but you said it contributes to my health problems, and I didn't realize the health consequences, and it's causing some strife with my kids.
I'm hearing you say that there are more good things about alcohol than bad. On one hand, alcohol helps you relax and to be social. On the other hand, it may be contributing to your health issues, and your children have expressed concerns about your drinking.
I don't think it's a big deal. I'm not so sure that alcohol is causing the problems with my blood pressure and weight.
I've got some information about the calories that are in alcohol. Is it okay if I share that with you?
Sure.
There are 123 calories in 5 ounces of wine. So if you have 2 to 3 glasses, which is 246 to 369 empty calories, and that adds up over the week. Your blood pressure is also too high right now. There is good evidence that alcohol raises your blood pressure and cholesterol.
That is interesting. I didn't know that.
What do you make of everything that we have talked about?
It looks like I need to make a change.
On a scale of 0 to 10, how important is it that you cut down on your drinking? 0 means not important. 10 means very important. Using that scale, how important is it that you cut down on alcohol?
Maybe a 4.
Tell me why you chose a 4 and not a 2 or a 3.
I know that my health is important, but I enjoy that glass of wine at night. Of course, I do need to lose weight. I don't know. I think maybe we are blowing this out of proportion.
It sounds like a part of you wants to cut back, but another part is not quite sure.
Yeah, that is about right. I really like to drink.
On that same scale of 0 to 10, how confident are you that you can make a change?
5.
Okay, a 5. Why not a 4?
I have a good track record that when I make up my mind, I am able to follow through.
On that same scale, how ready are you to make a change?
5.
Tell me why a 5 and not a 4.
Since my children are concerned and you seem concerned about my health, part of me wants to cut down and another part thinks things are being blown out of proportion. I just need time to figure this out.
So far, we've used the following elements of motivational interviewing: asking open-ended questions, reflective listening, summarizing, and affirmation. Next, we'll use the final step: elicit self-motivational statements in order to help her create a plan to change. Negotiate a plan.
Since your family has expressed concerns about your drinking and you have some health issues that alcohol can make worse, what are your thoughts about your drinking, and is there anything you may want to change?
I will have to think about how to change my habits. I know it is important to be healthy. I have lots to live for retirement, like travel and grandchildren.
Only you can decide on what will work for you. I have some strategies on how to cut down on drinking that have worked for other people. Is it okay if I share them with you?
I am open to suggestions to see what might work for me.
How about talking to your husband and sharing the concerns you have about the consequences drinking has on your health? Or the two of you could decide how much you want to drink on a daily basis. It could also be helpful to choose some nights during the week that you may not drink. You could also manage your stress in different ways. For instance, you may try going for a walk, yoga, or meditation.
I used to walk regularly and go to yoga twice a week. I just got out of the habit. I did feel better when I did those activities, though. I let work take over. It's hard at the end of the day to be motivated. I think if I decide on how many nights a week I have a glass of wine, getting back into walking at the end of the day and finding a yoga class may work. I will try to limit my wine to 1 glass 3 to 4 times a week. That gives me the opportunity, if we go out on the weekend, I could have 2.
It sounds like you have a plan. How about we check back in a month to see how things are going?
That sounds good.
Let's end with a review of the SBIRT process. 1. Raise the subject. 2. Provide feedback. 3. Enhance motivation by using ORs, asking open-ended questions, affirmation, reflection, and summary statements. And 4. Negotiate a plan.